We're talking to Doctors Hunter and Samuel, and of course the topic is the Cooperative Extension Program at Tennessee State University. Dr. Samuel, before we had our first commercial break, we promised that we would give you an opportunity to talk about the land grant program at the University of Tennessee in Knoxville, which was a program that was started much earlier, at least 30 years earlier than the land grant program at historical black institutions. Let's talk about that program.
Yes, the 1862 institutions tend to work with populations that are different from the ones that HBCUs or 1890s typically work with. At the predominantly white institutions, many of the young people and families are not, how might I say, they're traditional nuclear families in a lot of cases, so the young people have support and guidance. Few
disadvantaged children, etc.
Exactly. And when you're working with HBCUs or 1890s, however, we tend to work with limited resource, underserved populations. So that's one of the primary differences. And of course, the 1862s typically are much, much larger. They have a larger budget. They have more staff. So even though at our university we have a substantially smaller percentage of faculty and staff, we take pride in what we do, and we're really pleased with the programs that we do have, because we know that we are reaching a very marginalized and underserved and underrepresented population as it relates to children, families, farmers, low literacy individuals, and things of that nature.
You know, and of course, Dr. Sanders, dealing with family life, I think earlier you talked to us about family life and relationships. Let's see if we can have you to give us some additional information in reference to exactly what you do dealing with, excuse me, with family life and how that relates to the Cooperative Extension Program.
I'd be happy to. When I was here before, we discussed the grandparents raising grandchildren issue, and we also surmised that it is a growing issue. Not only are there grandparents raising grandchildren, there are also other relatives involved in raising dependent underage children. So we're focusing not only on the grandparents, but on also other relatives as caregivers. Last fall in September in Rutherford County in Murfreesboro, we had a conference there on grandparents and other relatives as caregivers of dependent children. And the theme was the challenges involved in raising dependent children. This year we are planning a similar conference to be held in the month of September, the 22nd to be exact, in Rutherford County also at the Patterson Community Center. And the theme is positive results in kinship parenting. So we know that because of many reasons these caregivers are having to raise these children that are not their own, it's important that people know what community resources are available to them, and that's why we bring the public together so that they would know we have speakers, a keynote speaker, and I want to say that the Honorable John Hood, who is state representative from the 48th District, will be the keynote speaker at the upcoming conference. We have also looked at parenting in general, and we have begun working with a prison population, female inmates, on teaching parenting skills to them. And this is a newly implemented program with this particular facility, but it's nothing new that we have done or are doing, because we have worked with the prison population in the past, focusing on basic life skills. So in Cooperative Extension, we have a gamut of areas that we concentrate on. We have farming, the small farms program. We have agriculture, natural resources, and livestock program, and nutrition, health and nutrition and food safety. So we reach the masses of people that the University of Tennessee does not meet, because we do not duplicate our audiences and our efforts, and we go into public housing to work with inner city individuals, and we also reach out to the schools and community centers as well as faith-based organizations.
Very good. And of course, Dr. Samuel, I would imagine that being involved in 4-H activities, that you come in contact with a large number of young people, and thereby you have an opportunity to influence these young people, to take them away from some of the negative things. What are you finding in terms of your dealing with these young people?
Well, we just had a wonderful program about a month ago at Tennessee State on the main campus entitled Hip Hop in the City, and it's a youth summit that was designed to do exactly what you're talking about, kind of combat some of the negative things that are going on. Part of what we want to do for middle school age young people, 11 to 14, was talk about the messages that are in hip-hop music, the messages that they're seeing on TV and in the videos, and how many times it is not conducive to positive development, and really getting them to think about how the sexual images, whether they be overt, whether they be covert, whether they are subliminal, but how all of that kind of plays into their decision making. And so a group called Promising Futures was here, Masters of Public Health, young ladies that talked about sex education, HIV and AIDS, and the implications for young people. It's a really, really big problem that we have right now. Just a growing number of youth and young adults are, you know, contracting HIV and AIDS, and so what we want to do is start talking to them early about how to prevent those types of things, and again, to get them to thinking about everything that they see on TV is not necessarily real, so we wanted them to think more analytically and more critically about what it is they're listening to, what it is they're seeing, and really getting them to think about the power of choice, because ultimately, despite what they see and what they hear, they still have that power of will and choice to make good decisions. And that's what our program is really all about, taking it beyond the whole land grant system has three components. You have teaching, you have research, and then our component, which is public service and outreach, taking what we know, what research says, and developing programs that are going to help children and families across the U.S. And so that's one of the things that I really, really like about this position. You don't just write journals and get them published in a scholarly journal and it sits there and nothing else happens. We get out there, find out what the issues are, and develop programs to help.
And so there's a hands-on activity in reference to dealing with these young people. Now, we've got about a half minute before we have our second commercial break. What does the 4-H stand for? At one time I understood the 4-H, this stands for something. What does it?
The symbol is a green clover, and the 4 H's are for head, hands, health, and
hard.
That's correct. Thank you.
I remember
that is it.
All right, of course, let us take this second commercial break, Dr. Samuel and Dr. Hunter, and we'll be back with our audience following this very, very short commercial break. Hunter and Samuel.